form about 5% of the total diabetic population. They are the type 1 diabetic children. Not only children, they can, type 1 diabetes can develop in children, it can develop in adolescents, and it can also develop in older people, like in the 30s or the 40s. You can still have type 1 diabetes. Type 1 diabetes is a distinct disease. It's totally different from type 2 diabetes, which occurs in adults. And in type 1 diabetes, what happens is the pancreas fails to make insulin because of the antibodies. The pancreas, the beta cells which are there in the pancreas are destroyed by the immune process. And because of that, the patient develop diabetes since they cannot make insulin. What needs to be done in such patients is you have to replace the insulin. Obviously, since insulin is lacking totally in these patients, they cannot use anything else. They cannot use the tablets which normally type 2 diabetic patients use. So they need to be given insulin. And insulin, as you know, is an injection, and this injection is given to these patients with type 1 diabetes, and also to other patients who need insulin can be given this insulin. But this insulin is given as an injection, and this injection of insulin is given subcutaneously into the skin. That's the conventional way how it was used. And insulin, as you know, was discovered in the year 1922, I think, almost 100 years ago. And this was first discovered by Banting and Best. And today is the World Diabetes Day, so this is also the celebration of the birthday of Dr. Banting. And therefore, this is celebrated as the World Diabetes Day around the world. And today is almost more than 100 years since the insulin was discovered. A lot of innovations are taking place in how you can give the insulin to the patient, what would reduce the pain to the patient, what will reduce the interference in the lives, because we have to take this every day throughout the life. You can imagine a young child who is taking insulin, takes 4 shots a day or 5 shots a day, and he has to monitor his blood sugar also 6 to 7 times a day by finger prick. And therefore this goes on throughout life. How difficult it is for these patients. Especially someone who is diagnosed at the age of 10 years old, for instance. He has to take insulin for the rest of his life, and this insulin is given in the form of this injection. So the challenge has been over the years, after the discovery of insulin, how do you give these injections by a way which is easy to use and therefore does not interfere with the patient's lifestyle, and is also accurate and will control the sugar level without causing any hypo or hyperglycemia. So that led to the concept of the artificial pancreas. Artificial pancreas is nothing but a hybrid closed loop system, it is called. This artificial pancreas is something, it has 3 components. First component is the sensor, which senses the blood sugar levels, and it's a constant sensor which senses the sugar level round the clock, 24 hours a day. And then the second part of the device is the transmission system, which transmits this information of the blood sugar readings to the injection device, which is called a pump. And after that, the pump delivers the amount of insulin, which it gets the information from the sensor. So based on the blood sugar levels, and also based on what the patient can feed into the system, himself or herself. When the patient is eating, like, let's say, carbohydrates, so it feeds into the system how much carbohydrate is going to take, 15 grams of carbohydrate or 30 grams of carbohydrate, and therefore the dose of insulin can be adjusted based on the sugar levels as well as the carbohydrate intake of the patient. So this is the closed loop, hybrid closed loop system. This is also called the artificial pancreas, and this has been, I think, released to the population at large. In UK, for instance, it is available for the NHS to use, and the NHS has said that it will use this patient in type 1 diabetic children and also in type 1 diabetic pregnant women. So these are 2 areas of clinical usage of this artificial pancreas. But this artificial pancreas is not something which is a panacea which will cure the diabetes. It's just a way of delivering the insulin, but it's an expensive way. And it's not possible to give this system to all the patients in India, in particular. Type 1 diabetic children now, they also come from rural backgrounds. They are very poor. They often do not have insulin. Do not know how to check their sugars. Do not know how to give insulin. So in India, the problems of type 1 diabetic children are totally different from what it is in the West. In the West, they are well educated and they know how to use the insulin, how to use pumps, and they are capable of following through with this modern technology or this innovation in terms of the insulin delivery devices. But in India, it's probably totally different. Often you have patients who don't survive, they die because they don't have insulin. And they have to ration their insulin. The patient comes from a village, he doesn't have insulin to give to himself. So there's a question of using a pump, a artificial pancreas or a pump like this. It's almost unthinkable that patients in India would have access to this technology. They have access to it, but they'll not be able to use it because of the cost involved. So that's what I feel, that patients in urban areas like Delhi or Bombay, or who is rich, who can have access to this technology, they can use this pump. It will be good for them. But having said that, it's not possible to use it to the majority of the patients because the patients are poor and therefore they cannot afford the system. And the basic fight in type 1 diabetes is totally different in India. The patients don't have insulin, as we said, they don't have access to insulin, so totally different ballgame altogether. So this afternoon we are going to talk about the artificial pancreas. Artificial pancreas is a device which is also called the hybrid closed loop system. in this system, the patient's blood sugar, this is especially true in patients with type 1 diabetes, in this the patient's blood sugar is monitored continuously by a continuous glucose monitor or a sensor, and then the information is fed to the insulin pump which delivers the insulin automatically. This is based on the blood sugar values, as well as the patient sometimes has to feed in the amount of carbohydrates that the patient is going to eat. So this is what a typical type 1 diabetic patient would look for in the ultimate treatment for the treatment with insulin. As you know, type 1 diabetics are dependent on insulin for the treatment, and they cannot do without insulin. Conventionally, insulin is given like an injection, subcutaneous into the skin, and that is given 3 to 4 times a day. That controls the blood sugar levels. However, in the artificial closed loop pancreas, or the hybrid closed loop system as it's called, the loop is closed. There is no manual involvement in this. The sensor senses the sugar levels, it passes the information on to the insulin pump, and the insulin pump delivers the insulin. So that's how it works, and this is like a boon for patients with type 1 diabetes, but of course it's not something that you can afford very easily. It's very expensive, and therefore it's not going to be of much use to type 1 diabetic patients in India, I guess, because the type 1 diabetics in India are very large in numbers. The numerical strength is pretty large. About 5% of the entire diabetic population is a type 1 diabetic patient, and most of them come from the rural background. So for them, most often it's very difficult to get hold of the insulin in the first place. They don't get the insulin, so they die because they don't have insulin available to them. So that's a far cry from having an artificial pancreas. Artificial pancreas means there's a lot of money involved in that, expensive, gadget-free, and the patient also have to understand how to take it. So I don't think it's for regular patients who come to the clinics in India, and therefore I don't think this advance is going to be of much use to the Indian patients with type 1 diabetes. Okay.